research proposal is on, can LSD help with patients that are diagnosed with schizophrenia? Over 80 million people worldwide are diagnosed with schizophrenia. With schizophrenia, this is going to be a non-curable mental disorder that can actually hold two sets of symptoms. Your first set of symptoms are going to be called your positive symptoms, and these are pretty much the more severe symptoms that you're going to have, such as hearing voices, thinking that you can control other people's minds, as well as in some cases even planning to harm people. Your other set of symptoms are going to be your negative symptoms, and these are going to be the non-severe as your positive symptoms. These being such as a lack of desire, of motivation, having trouble functioning for day-to-day activities, or even forming certain relationships. More than half of these people that are diagnosed cannot afford the treatment, and the treatment including antipsychotics as well as therapy, typically because these treatments are expensive. So our research proposal is pretty much, can this drug have medicinal properties that will help with the treatment of schizophrenia? And our age group would be from 18 to 25 due to the fact that this is normally the age where schizophrenia is typically diagnosed. Why did we choose this type of drug? It's a non-traditional approach to a non-traditional type of generation due to us focusing on the 18 to 25 years old, because we are first hand diagnosing them with the first stages of schizophrenia. We would like to take a non-traditional approach with it, just like how we did with medical marijuana. With medical marijuana, even though it is labeled as a drug and even more so a controlled substance, there's still medicinal properties, and we believe that LSD could have the same effects, as well as this is being more cost effective. Because this is a controlled substance, it could easily be taxed at a lower level than antipsychotics that would take a little bit more to produce. And then as well as this can potentially have less severe effects compared to antipsychotics, and I'll have my partners go into more details with that.
Some common treatments for schizophrenia that are currently being used are antipsychotics, which are taken daily by pill or liquid form, or from monthly to 2-month injections. The side effects from this can be harmful, like blurred vision, sensitivity to the sun, rashes, weight gain, and muscle spasms. In a study conducted in 2008, it was shown that the long-term effects were uncontrollable muscle movements, having risk of seizures, swelling, rapid weight gain, severe nervous system reaction, easy bruising or bleeding, and these risks were higher in women or older adults. We, as researchers, decided to choose LSD to keep an open mind for medication for these individuals that are diagnosed. And the side effects, we believe that the side effects from LSD can help ease the stress to individuals with schizophrenia without harming these patients after a while. The community affected will be the health physicians, scientists, and the patients diagnosed. This offers a new approach to handling mental illnesses like schizophrenia, and also we'll be adding research to this illness. The dosage amounts that we decide to use are 20 micrograms for the first test, and then the second test will bump it up to 25 to 75 micrograms during the second week of the month, and then we'll bring it to 50 to 150 during the third week, and then the last week we'll probably bump it up during our final test. Our methodology consists of setting a set criteria of the ages 18 to 25, since that's the most prominent age group that shows that they develop schizophrenia. The height and weight may vary to set an average result of data for the dosages. We'll have a DEA license that will be obtained to use LSD on these patients. We'll be researching daily, and to measure the dimensions of hallucinations, we'll be using SIRATs to do so.
Okay, so, as researchers, we had rules and regulations that we had to follow while conducting our experiment. If we did not follow these rules, our research could be considered unethical, unfair, or our results could even be invalidated. So first and foremost, we had consent, which we first had to make sure that we had full consent from our participants. Secondly, we had to make sure that we recorded their full consent for our data. And third, we had to make sure that we told them anything that could possibly cause them to withdraw from our experiment, such as negative side effects, anything of that sort. Secondly, we had to make sure to monitor our patients while under the effects of the LSD, just so that they cannot harm themselves. And we also had to make sure to give them the right dosage so that it could not hurt them, which was risk. Thirdly, we had to make sure to record accurate data. We had to make sure that everything that we did was, of course, accurate, and we recorded it accurately. Lastly, we had confidentiality, so that we had to make sure that they were autonomous and that nothing that we could have viewed from them was possibly biased, so that we couldn't form a false bias, or we could become biased. Okay, so if our participants did react negatively to the LSD, we would first have to go ahead and administer benzodiazepines, which basically would calm them down and help with irritability. Secondly, we would need to have them in a calm, stressful environment so that they wouldn't have a bad trip, quote unquote, or basically just so they wouldn't have negative effects of the LSD, such as the room spinning, them not being able to see where they are, just higher dosages, or some people just react differently to the LSD. So we would have to make sure to do that, and we would have to make sure to constantly reassure them that they are okay. Some people do feel as if they are dying on LSD, and if it is too bad to where none of those work, then lastly we would have to go ahead and sedate them, just because some people do react very adversely to LSD. Okay, so for our impacts, I guess the slide got deleted unfortunately, but for our impacts first, LSD is a hallucinogen, and because of that, it does have negative connotations in the medical world. So we wanted to open the eyes of researchers and show that it could have a positive effect for medicine, or it could be used in medicine further on. Secondly, we wanted to have researchers further advance our results and what we've done. We wanted them to view it, have their own opinion on it, which could then cause them to have their own hypothesis, which could then cause them to have their own experiment, and furthermore, hopefully furthering medication for schizophrenia or any other mental disorders where this could apply to in the future. Now, lastly, we did want to monitor the patients after for a while, just to see if there was any negative long-term effects that we could not see before we started the experiment.
Thank you for listening to our research proposal.